Good morning, good afternoon, good evening for everyone who joined today the Purina Institute Microbiome Forum event. And I am glad to welcome over 3,500 participants who would like to learn about microbiome science and how to put the science into clinical practice. My name is Dr. Natalia Wagemans. I'm leading the Purina Institute. Who doesn't know what Purina Institute is? That's the professional organization that shares science-based information and the best clinical practice of nutrition to global community of veterinary healthcare professionals around the globe to make them easy to implement nutritional knowledge into their clinical practice. The Microbiome Forum virtual event has been brought together 3 years back by Dr. Jan Sukadolski and group of experts who brilliantly put this program together. This program is very comprehensive, and since beginning of this event, this program is accredited by RACE accreditation for your professional education. If you follow the entire live event, you will be able to receive up to 4.5 CE credits, depends how much time you can dedicate to this program. And you will see at the end of the day, you will see QR code that will lead you to necessary steps to get your CE credits. So the question is, why microbiome? Why microbiome is so important? Of course, we know that microbiome has important role on the overall health of pets, but also you as a practitioners, you may receive a lot of questions from your clients about what and how to use, what type of probiotics, prebiotics or symbiotics, and what to do in any case of different GI diseases, keeping in mind importance of microbiome. And you know that it's not easy to navigate in this ocean of the knowledge about the microbiome, because the amount of research that is going around in this area is just enormous. This Monday, I looked at the PubMed library and just screened the last 10 years, how many publications on the microbiome has been published. And it's over 45,000, only those ones that has been supported by National Institute of Health research grants. And 21,000 of this 45, which is 47%, it was published during the last 3 years. Amazing. So how we as the practitioners, as the clinicians can really understand what is important and what can be used into the clinical practice. And that's where Purina Institute is coming on stage, because we help you to translate the knowledge, transform this power of nutrition into the skill set that you can use in your clinical practice. The Purina Institute has very extensive resources that you can free of charge use for the benefits of your patients to make pets live better and longer. To learn more about the Purina Institute, you can visit purinainstitute.com website and use all this information for your practical experience. But at the Purina Institute, you know that we really believe that science is more powerful when it's shared. And one of the latest projects that Purina Institute did this year, together with the group of 40 global experts in pet nutrition and pet health, we put together the book that names is Canine and Feline Clinical Nutrition Handbook. The purpose of this book is really to give you the best possible latest knowledge on nutrition and help you to bring nutrition in any case of your clinical practice where nutrition can make a difference. And you see Dr. Jan Sukadolski, who did a great contribution to this book with the chapter on assessing and managing the gut microbiome in canine and feline practice. If you want to check out this book and get it on your table in form of ebook, please go scan QR code, sign up for the scientific communication from the Purina Institute, and you will get your own copy of this latest nutritional knowledge. And that gives me a very good move to introduce Dr. Jan Sukadolski. I really believe in the audience, it's not necessary to introduce him because he is the celebrity in the pet microbiome area. But still, I will take a couple of minutes. So Dr. Jan Sukadolski graduated with a veterinary degree from the University of Veterinary Medicine in Vienna, Austria. Following several years of his clinical practice, he returned to academia and received his PhD in veterinary microbiology at the Texas A&M University. He is board certified in immunology by the American College of Veterinary Microbiologists, and currently he serves as professor and associate director at the GI lab at the same university, Texas A&M. And if you go to PubMed and you check the microbiome, you will see a name of Dr. Jan Sukadolski because he published more than 340 peer-reviewed manuscripts in the field of veterinary gastroenterology and the microbiome. And also since this year, Dr. Jan Sukadolski is the Purina Pet Care Endowed Chair in Microbiome Research. And now, Dr. Sukadolski, please, the stage is yours.
Mm-hmm. Thank you so much, Natalia, and thanks everybody for attending. It's great for this great outcome. More than 3,500 people registered for this event. And again, as Natalia said, I think it's very important that we put this all into clinical practice, right? I think the microbiome is a buzzword. There's a lot of research about it, but in the end, I think it's important for us to realize that it was always something we always already considered in clinical practice. And now we're just realizing that some of those mechanisms that before me might have not really understood now can really help us, improving diagnosis and clinical outcomes in our patients. So again, the goal of this meeting today and tomorrow is truly to put this from a clinical perspective. So we have experts, all of them are clinicians, some of them are academia, some of them are private practice, and we also have young investigators who did active research projects in this area. So that's kind of the goal. And so ultimately, I'm going to start with, in the beginning, with setting the stage, giving a more broader overview of what actually microbiome is, why is it important, what we realize that dysbiosis actually mean. I think there's a lot of work has been done. And then we're going to have a big focus on chronic enteropathy and treatments. I think we're going to discuss what is the use of antibiotics today in chronic enteropathy, tomorrow also in acute diarrhea. There are new guidelines. Do antibiotics are really needed, and if yes, in which cases? We're going to also talk about a little bit from Eva in her abstract about the risk factors. There are in human medicine, there's clear evidence that antibiotic usage is a risk factor for developing some of the chronic diseases we see nowadays quite often. And initial data of abstract will also suggest that at least in cats we see some similar. And then ultimately, we're going to also talk about chronic enteropathy. What is actually chronic enteropathy? Can we have good predictors? We know that most animals, the majority of chronic enteropathy, are going to respond to diet. And I think diet is always going to be the staple of therapy. And I think the data that we have from Paula and also from Catherine Bush suggests that diet is number one, but also that how put histology and ultimately treatment, multimodal treatment into perspective. And Susan Hodel also going to tell us later, she's a young master student from Zurich, about the long-term response. And again, you will see that probably diet is the number one treatment choice. So we need to focus on diets. And she's going to tell us how do those animals really do long-term follow-up, I think more than 1 year after initial treatment. And then by the end of the day, we're going to have a panel discussion. We're going to give some time, maybe like a couple of minutes after each speaker to answer some questions. But then after the last talk, we're going to have 30 minutes where we come back, all the speakers, and we're going to try to respond to some of your questions that you may have.